Medi-Cal's a very complicated system. What we heard very loud and clear is that there needed to be more integration, better coordination, more services for some of our most vulnerable. And so really able to take all of that feedback and package it into a roadmap, a 5-year roadmap called CalAIM that really is allowing us to transform the system.
CalAIM is an answer for people like Anthony, who questioned how to get his life back on track.
I've been through so much. I get choked up every time. After I lost my daughter, I just didn't care, Daisy. I didn't care. I wanted to die.
And I think that's when I knew I had to get you help, when you told me that you were ready to join your daughter.
That's why I went out there. I went in the streets.
A move that led to homelessness, substance use, and despair. But Anthony was able to recover with the help of a community health worker, Daisy. She connected Anthony with a range of behavioral health and physical health care services that helped him to take control of his health.
And now I'm capable to have a roof over my head. You know, I'm getting myself back on the track.
Anthony's now working again and is housed and optimistic. His story is a prime example of what California intends to achieve with CalAIM, an innovative and long-term commitment to transform and strengthen Medi-Cal, a program which serves 1 in 3 Californians.
CalAIM is our long-term vision for innovation in the Medi-Cal program. Medi-Cal is the cornerstone of the state's healthcare delivery system. We serve more than 14 million members in California, and I think everybody knows someone who is on Medi-Cal.
Medi-Cal historically has been extremely siloed, right? So we have so many players, and the beauty of CalAIM is really identifying key partners, enhanced care management providers, for example, that can weave all of those pieces together, build the relationships across the delivery system.
I think one of the biggest things that we're hoping to do is if you have someone who's extremely vulnerable and needing services, making sure that the right services and supports are being offered to them.
CalAIM is reforming Medi-Cal with a person-centered approach. This means partnerships with managed care plans, community-based organizations, healthcare providers, counties, and ongoing support from the state legislature.
And the partnership that we had there was huge, but this is just the beginning of a very long journey.
CalAIM prioritizes prevention while addressing social drivers of health and racial equity. Building on successful pilot programs, CalAIM authorizes partnerships with community-based organizations like Sacramento Covered, whose outreach is almost entirely field-based, to meet beneficiaries where they need it, no matter their zip code or language they speak.
The beauty of this program and really the hope and the design of CalAIM is really about serving clients, serving patients with all of the needs that are outside of the medical office.
CalAIM is California's first statewide effort to offer enhanced care management. Over half of Medi-Cal spending is attributed to the 5% of beneficiaries with the highest cost need. Whole person care pilot programs proved that enhanced care management and community supports can improve health outcomes, with fewer people going to the hospital for inpatient or emergency department care.
You just don't know how much you really have helped me, you know.
CalAIM's goal is more success stories like Anthony's. Significant reforms that spell greater access to equitable healthcare and a healthier California for all.